The reality of Medicaid, a lifeline for our communities. I think we can all agree in our country we have areas where real change can make a difference. One of those areas is the support systems that help families, children, workers, and the elderly, the backbone of every community. Whether you realize it or not, someone in your life is directly impacted by Medicaid assistance. It could be a family member, an aging parent, a young child, a coworker, a cashier at your grocery store, the person standing next to you in church. The need is widespread and the numbers make it clear. In Missouri, the highest percentage of Medicaid recipients are children. In Iron County, Missouri, 58.8% of children rely on Medicaid, while in every other county in Missouri, that percentage rises to between 54.9% to 70.5%. The second largest group of beneficiaries is adult parents who are working to provide for their families or who are aging. In Howard and Knox counties, that percentage is 6.8 to 9%, while in the rest of the state, it's between 7 and 11%. These are not abstract numbers. These are real people in every community across the state. When we talk about getting by, it's not just about paying bills. It's about caring for our families, whether that means raising children, supporting an aging parent, or managing an unexpected health crisis. I know this personally. My dad passed away 7 years ago. He was a veteran, and during his final days, he needed some assistance. Without that assistance, I have no idea how we could have cared for him at home. I know that anyone who has ever been a caretaker understands the relentless need for more support during times of family transition. It's an emotional, physical, and financial burden that no one should have to carry alone. The reality is that many people in this country work multiple jobs just to get by. That is, while these programs exist, they provide a foundation so that parents can work, children can be cared for, and the elderly can receive the dignity that they deserve in their final years. The only reason I can imagine someone wanting to cut these essential services is that they do not truly understand the impact such cuts would have on everyday life. If Medicaid were gutted, people would no longer be able to show up for work because they have no support for their children. Nursing homes would close, leaving families with no choice but to care for elderly relatives themselves, often without necessary time, resources, or medical expertise. So, America, are we ready to take on the full weight of these responsibilities alone? Or will we stand together to protect the programs that make it possible for families, workers, and communities to survive? It is really time to recognize that Medicaid isn't just about politics. It's about people. It's about our communities. It's about our families. It's about us.